Hello everyone, my name is Anna Cronin and I'm a PhD candidate at Sturt University, and it's a privilege to be here to talk to you about toddlers with cleft palate and their experiences of early childhood education and care. Our data and the children's treatment and access to services reflect our Australian context. The data are taken from a larger ethnographic study that we undertook as part of my doctoral thesis with some young children with cleft palate and their families, investigating holistic child and family-centred care to improve communication outcomes for these same children. My background is as a speech language pathologist, and I've been working with young children with cleft palate and their families for the past 8 years. The first 3 years of life are a time of significant growth and development for all children. Having a congenital health condition, such as cleft lip and palate, can mean children require surgery and other interventions in these early years. Cleft lip and palate, for those of you that aren't so familiar with this condition, occurs when the roof of the mouth or the palate, so we have the bony hard palate at the front and the muscular soft palate at the back. So if the palate and or the lip do not fuse correctly very early on in utero, this condition may be associated with a syndrome, or it may happen just for reasons unknown. And having a cleft palate can put a child at risk of communication, hearing and feeding difficulties. If they have a cleft lip, it can also mean that they have a facial difference. So this photo here is of a baby with an unrepaired cleft lip and palate. You can see that that gap extends through the lip into the gum line and through the floor of the nose. Research with young children with cleft lip and palate has focused on treatment and intervention, and previous qualitative research has been collected predominantly via interviews. So we took a family-centred approach to our research because we really wanted to privilege the voices of families and learn as much as we could from them. We wanted to understand more about the impact of cleft palate and the burden of care on the daily lives of young children with cleft palate and their families. In this photo here, you can see another baby with cleft lip and palate, although this baby has had his surgery and has a repaired cleft lip. This surgery can happen around 3 to 6 months of age, depending on what country the child is in and if they have any other concomitant health conditions, which might mean that surgery needs to be delayed. So the aim of our study was to increase understanding of the lives of children with cleft lip and palate across contexts such as early childhood education and care, as well as the experiences of their families. We used a focused ethnographic methodology with children with cleft palate and their families. This approach is really innovative, as research with this population to date has generally focused on deficits. The importance of qualitative research and child and family-centred care has only really gained momentum in the last few years with this population and with the health professionals working with them. This research was aimed at adding to that body of literature and trying to affect some change in services provided. The participants in this study were 7 children with cleft palate, with or without cleft lip, and 13 parents and 12 significant others, including educators, grandparents, aunts, siblings. The child participants were between 2 and 3 years of age and had a cleft palate. To participate in the study, the families needed to have sufficient English to provide informed consent and participate in semi-structured interviews. Participants were recruited through parent support groups. Data collection was completed through home visits and visits to the children's early childhood education and care settings. There were 84 artefacts collected, as you can see here, as well as speech and language assessment data, which were part of that larger study I referred to earlier. All the data were analysed inductively using in vivo and analysed participant by participant using thematic analysis. Results revealed the joys and complexities of raising a young child with cleft palate. The children and families themselves had many strengths which they drew on every day in their lives. but they faced challenges accessing services and managing people's reactions to the children's facial differences. Nearly all of the children attended early childhood education and care, either family daycare or centre-based care, although access and inclusion were concerns for some families. Ethnography allowed for observation across contexts, and this revealed differences in the children's communication and interaction depending on setting and communication partners, which was significant. The children's strengths and personalities were described with real love and care by their families and educators, and strengths included their temperaments. One grandparent described her grandson as a delightful kid. Their perseverance was another strength. The children were good communicators with their families, trying over and over if they could not get their message across, or finding a different way to show what they wanted if there was that communication breakdown. Families were proactive and had support from extended family members and friends. As one mother described her son's speech therapy, we just constantly narrate everything or just describe everything. Everyone is on board, my sister, my mum, my husband's family, everyone. This same mother talked about how grateful she was for all the support, as intervention could be exhausting if you're just doing it on your own. Families also face challenges navigating multiple clinics, hospitals and health services, as well as in the community at large. One mother described how much she just wanted to be invisible because she felt so very exposed taking her baby out before his lip repair surgery. Of people's reactions to looking in the pram at her son, she said, it was terrible. People just look, like the looks you get. And it's not, people aren't trying to hurt you, but it's just a natural human reaction, I guess. This went on for 3 months for her until her son's first surgery, and had a really significant impact on how she felt about him and herself and getting out and about. Accessing early childhood education and care was straightforward for most families, and a really important context for the little ones in terms of their social and emotional development, making friends, having time away from their families, and learning and growing like other little ones without cleft lip and palate do. However, 2 children had additional needs in addition, to their cleft palate. One as part of an underlying genetic condition, which at that point had not yet been identified, and another child, again, there was no unifying diagnosis, but she did have some other things going on. And for these 2 children, they needed extra help with their eating and drinking, or support around their anxiety, or global developmental delays. And these needs presented challenges for their families when they went to access early childhood education and care. So as you can see here, one child could not attend early childhood education and care because the centre could not apply for inclusion support for her. And so she really just had to spend a lot of time at home with her mum as a result. Another child's family chose to wait to disclose that their child had additional needs until her place had been confirmed, as they'd previously been turned away from an early childhood education and care centre that they'd wanted to attend. It was their understanding that it was because of this child's additional needs that they couldn't attend. Withholding that information and disclosing it after the child's place had been confirmed created some tension between the family and the centre, but her family were really determined advocates for her, and were adamant that she access early childhood education and care. So you can see for these 2 families, the challenges accessing early childhood education and care manifested in different ways, but they had far-reaching implications for the children's social inclusion and the family's financial and emotional well-being. So the toll that it took on these families differed, but it was there. Being able to take an ethnographic approach and observe the children across contexts revealed differences for the children, which would not otherwise have come to light. So, for example, discussion with one child's educator revealed that this child never spoke at early childhood education and care, and the practitioners didn't think that she could talk, so they didn't really try to engage her in conversation or expect any verbal responses from her. However, at home, And with communication partners who knew her, this child was speaking in 7 and 8 word sentences. Her parents were unaware of how quiet she was at early childhood education and care, and her teacher and the other practitioners were unaware of how much she could do. So this little girl had a fluctuating conductive hearing loss associated with her cleft lip and palate, and this was contributing to her difficulties in terms of being able to hear and participate in a noisy environment. Her teacher expressed surprise when she saw this little girl talking with me when I visited her at early childhood education and care at her centre, so the differences across contexts were really striking for this child. Ethnographic methodology really facilitated the collection of unique insights into the lives of toddlers with cleft palate and their families. And these findings highlight the unique strengths and individuality of the toddlers, as well as some of the barriers that they and their families face. It really suggests that practitioners and health professionals working with toddlers with cleft palate may need to support and promote their access to early childhood education and care. If families do come up against some of these barriers that the families in the current study did. By highlighting some of the strengths and challenges of toddlers with cleft palate, it is hoped that this research will support speech pathologists and other professionals' practice to help young children with cleft palate and their families thrive.